was sinking deep in sin, far from the peaceful shore, very deeply stained within, sinking to rise no more. But the master of the sea heard my despairing cry, from the waters lifted me, now safe am I.
Love lifted me, love lifted me, when nothing else could help. Love lifted me, love lifted me, love lifted me, when nothing else could help. Love lifted me. All my heart to Him I give, ever to Him I'll cling. In His blessed presence live, ever His praises sing.
Love so mighty and so true merits my soul's best songs, faithful loving service to.
Hello everyone. I ask God every day, who can I help? And He shows me depressed people. I'm Dr. and Pastor Joe Allen of Panama City, Florida, and you're watching Depression Hurts. In today's program, we will enter into a very diverse area of dual diagnosis of substance abuse and major depression. Thousands of people out there are suffering this. The CDC has estimated 10% of all Americans go through substance abuse depression needlessly. By now I'm sure you know everyone has bad days, down periods in life, so to speak. Most cases this is temporary, but clinical depression is a very lengthy, serious mental disability. The difference between the simple blues and depression is severe consequences, and not only for the patient, also for his or her loved ones. The mode of disease prevents you from having a normal, joyful life. A person of one of the following categories is most susceptible or likely to have addiction depression. For example, groups including middle-aged adults aged 45 to 64, females, African Americans, Hispanics, and even people unable to work and attain normal health insurance coverage. These are most likely to suffer from this dual diagnosis disability. A large number of people are battling depressive disorder because of alcoholism or drugs. The alcoholism in itself, the alcohol is a depressant, you know, triggering symptoms such as lethargy, sadness, and a feeling of being without hope. 1 in 3 persons struggling with this disease, I might add again, poses a high risk of injury to themselves, like suicide or other self-harm. The depression suppresses the immune system in the body, weakening it, causing it in most cases to have chronic illness and physical ailments. Adding drug or alcohol abuse to the mix only increases your risk. In such cases, chronic illness and physical ailments, adding alcohol or drugs abuse, in this increases your risk, like I said. Now listen carefully for a moment. Listen carefully. I don't want you to get the wrong idea. Alcohol and drug addiction can cause mental illness. However, Many experts agree mental illness, however, does not necessarily cause addiction. When those things are quickly diagnosed, if not, it can trigger the use of alcohol or drug abuse. So your main thing would be get to your doctor as soon as possible. Depressive disorders often cause acute, uncomfortable feelings such as sadness, hopelessness, numbness, isolation, and sleep and digestive disorders. These problems present the patient overwhelmingly, and it's very tempting to self-medicate oneself, resulting in depression. Because of this compounds the depression, and things will much be worse for the patient. Don't be fooled into thinking a few drinks at the bar or a hit of cocaine might relieve your symptoms. The backlash of these things, when those chemicals wear off you, brings new lows of depression. This is called withdrawal depression. It can trigger the use of these substances because it's temporarily helping, people think, to put an escape of bad feelings or some highs only. But the real truth is, now listen up, it's putting a person into a medical emergency. This can be life-shattering for anyone. Some folks in addiction recovery are shocked into not even taking prescription drugs from their doctor or any over-the-counter medicines either. They take things in too much contrast from one end of the spectrum to the other without looking at the truth. This can be certainly traumatic. Yeah, reality sets in, doesn't it? Are you willing to endure the horrible symptoms of depression rather than safely take prescribed medications from a competent psychiatrist? There has to be a happy middle ground in safe recovery from substance abuse. The hard way out, cold turkey, they may call it, is definitely not the best way. Not. This so-called willpower way, induced method, probably comes from a friend or relative's recommendation, not from a medical doctor. No matter how well their intentions were, your friends don't have sufficient knowledge or credentials to give advice medically. Proper certified and licensed therapists use a psychosocial evaluation as a measuring stick in efforts to find out how much abnormality began first, the addiction or the depression. It really doesn't matter that much because the patient may be too numb or sad within themselves to even focus clearly on the illness. Coming out of the fog of addiction, depression, illness, a person may all of a sudden ask, "What am I doing here?" And this is a signal, would you, a valid observation due to a lack of original understanding of the picture. At this point, he or she cannot know whether addiction or depression happened first. It's kind of like the old adage, which came first, the chicken or the egg? It doesn't matter that much. What matters is if the patient's willing to admit they're ill and need help, that's when help comes into the picture. Inside you to do its healing way within your mind and physical being. Well, we've reached the end of today's session, my friends. Be sure to watch for part 2 of this series of depression addiction. Until then, I'm Dr. Joe Allen, and as I always say, may the good Lord bless and keep you and give you peace.